Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you for being here today to where we can provide updated information to you regarding our COVID-19 response actions. Also today joining us again is Mayor Nan Whaley from the City of Dayton, Sarah Hackenbrack from the Greater Dayton Area Hospital Association, and then Michael Doan, Medical Director for Public Health. I'd like to start today's presentation with the background display behind us. And you see that logo, and you see public health, and underneath public health you see the three words: prevent, promote, protect. And our mission at Public Health is to improve the quality of life in our community by achieving the national goals of public health. Prevent the spread of disease, promote healthy behaviors, protect the environment. Prevent, promote, protect. That's that logo. That's that national logo of public health. Those are the three prongs: prevent, promote, protect. We do those things to where we can achieve our vision. And our vision is that Montgomery County is a healthy, safe, and thriving community. And we understand, as well as anyone else, that a thriving community has a thriving economy, and it's economically strong. Because when a community is not thriving and when the economy suffers, public health suffers, and our health status of a population suffers. So we, as well as everyone else in this state that listened to the governor's news conference today, were absolutely thrilled when he told us all that beginning May 1st, he will have a phased approach to reopening this state, beginning with the business community. And that's what we all want. We've talked at length, really since the beginning of March, about flattening the curve. I don't know that any of us will ever be able to again forget what that curve looks like. What would have happened had we not had social distancing, how we've been able to flatten it over time, and how we have not exceeded our healthcare capacity. That's outstanding news for this community and this state. But we also heard today, and the governor has been alluding to it, it will be a new way of life and a new way of conducting business for all of us as we move forward. And in the chart to the left here, later in this presentation, Dr. Doan will be walking through what that new version of the epidemic curve looks like for us and the considerations we need to take into place. So as the governor begins to look at all the criteria for reopening this state, he will be looking at public health indicators. We've already talked about those. Adequate capacity for testing, adequate personal protective equipment, adequate capacity in our hospitals, being able to identify ill individuals, isolate them, quarantine close contacts, and then having a sustained reduction over time in confirmed and probable cases. Those are the public health indicators that the governor will use in his decision making. Those are indicators, but then there are also public health considerations that weigh into this. There's no vaccine, and we've talked about that. There's no antiviral treatment, essentially, at this point. It's supportive care. We have to understand that COVID-19 as a virus will continue to circulate globally. It is not going away. It will be with us. That weighs in on Dr. Doan's new curve. And then, perhaps most importantly, the public has to have confidence that as this order and parts of it are lifted, that they are going to be safe in the environment and when they return to work. So those are huge considerations that the governor will take into consideration as he makes his decision on how to begin a phased reopening on May 1st. And then obviously the economic considerations. And he's indicated that there will be new guidelines for businesses that are allowed to reopen, as well as those that continue to operate as essential. I think we all heard today in a very clear way, even though the governor at times tends to lay the crumbs down, we all follow it a little bit, then suddenly there's an order, but he's already got us believing it by the time all those crumbs are laid down and so forth. It's a new way of life for all of us. And it's about the safety of customers and the safety of employees as we begin to reopen. And it's clear that, as he indicated, face masks will be with us for a very long time. And social distancing, in whatever form that's going to be, will be with us for a very long time. So, that being said, today's press conference at the state level was absolutely encouraging. And the reason the governor is able to now begin reopening on May 1 is because of the outstanding things that have been done by all of our citizens and all citizens throughout this state in terms of complying with that stay-at-home order. It's been a challenge to all of us. It's not been easy. It's been a time of tremendous uncertainty and anxiety. But as a county, we should be very proud of the actions we have taken as individuals to make sure we did our part, to always do the right thing. So I'd like to specifically thank our citizens for their patience and their understanding as we moved forward as a united system of partners here in Montgomery County to do what's in the best interests of protecting public health. And then lastly, public health has, because all of this information changes so rapidly and there's such a huge volume of it, we have redesigned our website. And so if you go to phdmc.org and take a look at the new COVID-19 website, our hope is that you find it much easier to navigate. And with that being said, I would like to welcome Mayor Nan Whaley to the podium.
Thank you. Thank you, Commissioner, and thank you again for Public Health's terrific leadership, not only through this, but through so much that's gone on in our community this past year. First, I want to say thank you to Henny Penny, which is a company that is north of town, and both Steve Cobb and Rob Connolly have been great, terrific leaders in our community. Henny Penny is donating 2,095 masks to City of Dayton Police and Fire. Our fire department particularly is getting low on masks, and so they called today and offered that as they got them from some of their China suppliers, and is just donating that to our first responders, and we want to say thank you for that. Tuesday, when we meet again, whenever the next press conference will be, I'll have a list from the city of all the different groups of people that have donated or people that have cut pricing to help our first responders, and we'll share that at our next press conference. But I wanted to specifically recognize them today and just thank how the community has come forward, both for healthcare workers and for our first responders. It's been really, really impressive. As Commissioner Cooper was saying, we are heartened by the governor's message today, but I want to be tepid about it because there are still significant issues that we have to work through to open. As the commissioner said, we still don't have enough PPE in this community. If the City of Dayton, if Miami Valley Hospital, if Kettering Hospital is still taking requests from the community for donation of personal protective equipment, we don't have enough. And that's going to affect our ability to even do elective surgery because we don't have enough PPE. So we still have work to do there. We still have work to do in testing. We don't have enough tests in this community, so the health commissioner and public health can do their work of contact tracing for when we do fully open up. So even if the governor allows people to go to work, which, you know, there will be places where there'll be social distancing on essential and non-essential around working, we will still encourage people not to go out unless they absolutely necessarily have to, because this is still going to be among us, and we still are not going to have the tools that we need in this community to keep people safe and keep them alive. And that will be our priority as a community. I know it's the governor's priority as well. So I think the best example I've heard, and I can't even remember where I've heard it from, but and if you're in high school, this doesn't mean anything to you, but if you're over high school, we all remember what it was like to fly before 9/11. You would walk up right to the gate, there was no security, you could move in and out, and then 9/11 happened. and our airports completely changed. Our airports actually went to some of this kind of order where there was incredibly difficult security that took hours and hours to get through, that it was nearly impossible to fly, and then they put forward systems that is the TSA today and that has normalized how we fly. But it is very different than if you flew in 2000. That's what's going to happen in our community in all sorts of arenas. The way that we touch each other, the way that we hang out in parks, the way that we eventually will get to organized sports, which will be probably the last thing that we get to do. All of these things will change because of this virus. That's a hard pill for us to swallow, but it is necessary because we put human life before everything else. And if as a community we value people's lives no matter what their age, then that's why we have to make sure that we do our part to make sure our community continues to stay safe. So we're excited about this small step, but we still have a lot more work to do to be ready to go. Thank you.
I'd like to welcome Sarah Hackenbrack from the Greater Dayton Area Hospital Association.
Thank you, Commissioner Cooper. Thank you, Mayor Whaley. This is one of those transition moments where I recognized on my way into the building that I had forgotten my mask. And it is something that I am now accustomed to having with me when I'm going to be in a public setting. So I think this is that transition that the mayor was referring to, that life will start to feel different for us as we adapt to these new rules and situations. Like the commissioner, like the mayor, our hospitals are interested and desire seeing a reopening of our communities and of our economy, but we recognize and urge caution that it will still be needed. Caution will still be needed as we proceed down this path. Two things that the mayor mentioned that are going to remain critical for the safety of our hospitals and their ability to provide care as we proceed and move forward are going to be the availability of PPE, the personal protective equipment, and testing. So from the PPE standpoint, these are the types of materials that are needed right now for COVID-19, but they are also needed in everyday providing of health care, the regular surgeries, the elective surgeries or non-essential surgeries that have been delayed, the equipment and the PPE that's used when you go to your dentist office. Even sometimes if you have a pet and you take your pet into the vet's office for surgery, some of the same types of PPE are used in those settings. And the risk and the challenge is that if we don't have enough PPE in our environment, in our community, then we risk exposing our healthcare providers when they are at the most vulnerable. And if we have exposure widespread in our community that it impacts our healthcare workers, then that means they are also not going to be available to be on the front lines to care for each and every one of you. And that is our goal. We want to make sure that our hospitals and our healthcare teams remain healthy and available and open to care for you, whether it is during COVID-19 or it is for any other critical illness or injury that you might have that brings you to one of our region's hospitals. Yesterday, we also talked a bit about testing, and we know that adequate testing is what helps us understand how widespread this virus is in our community. It allows us to take steps to isolate individuals, and that also helps us protect others and prevent larger community spread within our region. Widespread rapid testing is something that we are working towards right here within the Dayton region. Rapid testing means the ability to return the test, conduct the test in less than 24 hours right here in the Dayton area. Our focus right now, per the guidance from the CDC and the Ohio Department of Health, is for those individuals that are hospitalized and our frontline healthcare workers in partnership with our local public health departments to ensure that our skilled nursing facilities and nursing homes, as well as their employees, have access to testing, and then to ensure that our first responders all across the Dayton region, our fire, police, and EMS, can be tested quickly and rapidly right here in our community. We are doing some of that rapid testing right now, right here in this community, but we need to be able to do more rapid testing, and it needs to be more widely spread and available through a doctor's order. Again, the two key components that we see and understand from a hospital perspective as we look at what the community will look like and how we will reopen our economy, we must ensure that adequate PPE, that personal protective equipment, is available, and widespread rapid testing is available for people in our community with a doctor's order. Thank you.
I'm not sure he needs any introduction, but Dr. Michael Doan.
Let me get this down. Hi, my name is Michael Doan. I'm the medical director for Public Health Dayton-Montgomery County. We've heard some encouraging news. It's not entirely clear what's going to happen, but the announcement by the governor that the plans are in place to think about how we sort of come out of this situation. We've all heard about flattening the curve, maybe more than we want to, trying to avoid that overwhelming spike in COVID-19 cases. We've all seen the graphs with the line representing the healthcare system and the capacity in that line that we don't want to go across. We've all seen the graph with the big spike in cases and the alternative lower, gentler, flatter curve that, in fact, all of us are really shaping at this point with all of our decisions. So, once again, I'm going to try and speak loudly enough you can hear me as I point here. We've got that big curve that we wanted to avoid that was going to stress the healthcare system. We've got that gentler curve, which we're sort of trying to follow. And the question is, we flatten that curve, what's going to happen next? What do we kind of expect? Gradually, the restrictions will end. And, you know, as a physician, I often think of things in terms of suffering and patients and trying to alleviate that suffering as well as getting them well. And I would argue that if the restrictions are lifted thoughtfully, we can minimize the suffering sort of all around. If we take the restrictions off too soon, then cases are going to rise. They will cause a different kind of suffering with more illness and death, possibly overwhelming the healthcare system. That would also mean that other medical conditions couldn't be taken care of, heart attacks and other sorts of things that could be bad for all of us and increase suffering. If things are extended too long, then there is an economic suffering, and that also needs to be considered as we thoughtfully sort of take away those restrictions and allow that economic recovery to begin. The hope is, of course, that as the restrictions gradually come off, the number of cases will stay underneath the capacity and just kind of dwindle along at some manageable rate. This is not a disease that's just going to go away. We're going to have cases. More people are going to catch it. Unfortunately, more people may well die. But our best chance is to extend that and get better at treating this disease and get better results for people as we move down in time. And this is not a clear-cut choice. It's not just economics versus health. If we think about suffering, beyond the economic effects of all the restrictions, there are health effects. People are waiting for elective surgery. People may be in pain because they can't get that knee replaced. People may be waiting other elective surgeries and continuing to have problems with symptoms that could be alleviated, and they're waiting to get that taken care of. Not everything can be taken care of by telehealth. Sometimes the provider needs to see somebody, do the exam, and get a good assessment done, so that those visits are now very restricted. So there's some suffering that goes along with that. There's also the suffering that we've heard about, the mental health challenges that go along with these restrictions. There's also the concerns related to child abuse and domestic violence. So that it's not just about the economy, there's other kinds of suffering going on. On the other hand, the fact is there's economic suffering with overwhelming disease and death. And that places, we know from history, places that follow that red curve, okay, have tremendous economic disruption. People get scared, employees get sick, managers get sick, employees don't want to come to work, and so they don't. People stay home, that is, customers stay home, even without a stay-at-home order. So that there's tremendous economic disruption there, so that it's not just about healthcare, it's also about the economy and trying to keep this manageable. For those reasons, trying to make the restrictions come off too soon may also damage the economy in ways that we can't anticipate, but will certainly happen if we do get spikes and people continue to be scared for a long, long time about trying to re-engage business as they used to. In summary, I guess I'd just say there are different ways of suffering in this situation, and they aren't equal. Businesses that are sort of open, businesses that can send people home and do work from home, they're kind of doing okay. Other businesses, this is just devastating. So that the suffering is not distributed equally. On the other hand, the plan that we've got and the restrictions that are in place and the gradual lifting of those restrictions is designed to minimize the suffering for all of us. Some are going to suffer a lot, some will suffer less, but the aggregate amount of agony, if you will, the suffering is going to try and be as little and as minimal as we can. You know, none of us asked for this. I didn't sign up for this when I became medical director. I know that Sarah at the Greater Dayton Area Hospital Station definitely did not sign up for this when she took that job. None of us wanted it, but this is our life today, and so we got to deal with it. And I think we just need to hang on a little longer. Stay compliant with what this gradual release of the restrictions is going to be, and I hope that through that, we can all help to minimize the suffering for all of us in this community. Thank you. Are there any questions? Yes.
Doctor, I say this with the utmost respect. At what point will Montgomery County, City of Dayton, tell the governor we can't do this yet? How many people will be sacrificed or die because of this illness, disease, for lack of a better word?
Yeah.
Before somebody says, hey, no, we should stop and we close everything.
There's no answer to that.
And all based on economics versus people's health.
Well, as I said, it's not just economics or health. I mean, there are implications both ways. And what we know from history about these sorts of things, and this is history that goes back to the Middle Ages, okay, when they had very little to do except to isolate people and quarantine people. And there have always been both health, political, and the economic consequences. And trying to balance those in the Middle Ages, they didn't have much to work on. They didn't have germ theory or anything. And so they would, they had city walls and they would close the gates. The economy stopped and it was terrible. And people were very upset. So the next time they tried leaving the gates open. And cholera ravaged everybody. They had all these people die. Business got all disrupted anyway. People were very upset. And so what we've got today that they didn't have then was we've got the ability to look at how we have germ theory, we know about viruses and that sort of thing, and we have the ability, as they talk about over and over at the state level about these different models, we have some sense of what the different mixing of people does in terms of spread of different types of infectious diseases, and using that, we can be much smarter about what's going to be that best line to try and minimize the deaths as well as minimize the long-term effects and the bad things that can happen from the economic disruption. That's not the answer you might have been looking for, but that is the answer.
My only other question, Doctor, for you would be,
sure.
Follow-up to that is, it's a huge question for me to ask you, and if you don't know, I understand, and I mean this with the utmost respect for you and your department. Are we ready for round 2 of the next unknown disease?
Well, I'll tell you, after the last couple of weeks, we're better prepared than we were before. And that we are, if I might just say this, I don't want to, with the utmost respect for the rest of the state of Ohio, okay? The emergency management area here that we're in, West Central Ohio, is consistently the best organized, most communicative, and most collaborative and cooperative of the different regions in the state. That has to do with the sort of long-standing relationships between law enforcement, fire, EMS, different government levels. Okay, we have how many jurisdictions within this county? 27 or 28 jurisdictions within this county. It's not just all Dayton and Montgomery County. And those people work together. They're in communication with each other all the time. So that we've got a really good situation here in terms of being able to kind of follow all that and work together. Even as we've got a joint, what do they call it? Joint command? Unified command for the Emergency Operations Center, which includes people from all across the county, all the different kind of disciplines and stakeholders. And every time we do something, we're learning. We're already within public health and other places making lists of this didn't go so well, we got to do this better next time. So that I think from that standpoint, we're going to be, this is a tremendous learning experience, although a painful one, that we're having to prepare us for the next time.
Do you ever foresee the day when individuals go to a grocery store or a concert, their temperature is taken before they're allowed into that area?
I hope it doesn't come to that, because I'm hoping, I think that what I've been most encouraged with is the fact that people are taking their own temperature, and that, with some exceptions, by and large, if people are sick, they're staying home. By and large, people are saying there is a greater good here, and that I'm going to do my part for that. And we all get you go to the grocery store, and there's somebody walking down the aisle coughing, but by and large, most people are doing well. And the Centers for Disease Control had some interesting information that they had, and they were looking at the social distancing, and they had 4 different states. The thing that I found most interesting was just a very short paragraph that said that the evidence is very strong that the longer those measures are in place, the more people conform to them, okay? So despite the people trying to be heard behind Governor DeWine and the ones behind Governor Brashear, the majority of people in the population, the evidence is, with continued time, more people are wearing masks, more people are doing the kinds of activities that we would want them to do to try and control this. Thank you.
Can we talk to the mayor?
Sure. Oh, if you want.
Prior to the mayor speaking, if it's all right, Mayor Whaley, I would like to leave our community with the following comfort. To specifically answer your question about the next thing that happens. This county and our West Central Ohio region will be ready and will respond the same way we have responded to this pandemic, whether it happens again later this year or next year or in the next 5 to 10 years. This community will always be ready to respond to protect our citizens.
Thank you, Commissioner. Hi, Chris.
Good morning. Good afternoon.
Hi.
I'm lost.
Mhm.
Thank you.
We all are.
In regards to the city of Dayton, how closely has the city been working with the governor of the state of Ohio to, in fact, open up areas of our Dayton market, especially in Montgomery County as well?
Well, we've been working very closely with the governor and the lieutenant governor and the head of health, as well as our local partners here, on a whole host of issues, from making sure and fighting for testing supplies for this community, to giving feedback on the quickness or slowness of some bureaucracy in Columbus, to just concern to make sure that we do this right and do this well. I think we've heard from, I think the Ohio Restaurant Association went to the state last week or this week, and from our restaurants, most of our restaurants and bars, for example, have been hurting significantly, and we know that 1 in 10 people in America work in retail. They have one chance to get this right. So we can't be opening and closing and opening and closing for these. It's just incredibly expensive for these businesses that aren't your big small businesses that have 500 employees. That's not what we're talking about here. And so for us, I think, and all of us, we are of the mind of we want to be very thoughtful about this. We think the governor has been thoughtful from the beginning on it and seeking the input from our communities and from mayors across the state. And we don't want to mess this up because that will really wreak havoc on this economy.
Has there been any talk between the city of Dayton or for that matter Montgomery County in a whole? It's my understanding the SBA ran out of money for small businesses.
Mm-hmm.
Will the state be able to help the smaller cities like Dayton?
Yeah, I don't think the state will be able to provide funding like that unless it comes from the federal government. Keep in mind, the state is just like the city in the sense that it has to balance its budget, just like Montgomery County and local jurisdictions do. The federal government is where this relief has to happen. We did a press conference this morning, Ohio mayors did, around getting relief for our local communities. We, have lost and experienced a tremendous loss of revenue because people aren't working, and most of our dollars in Ohio cities come from earnings and income tax. So just like there's paycheck protection for private sector, which we fully support, we need to have paycheck protection for our first responders too, and that's what we're calling for in this bill. There, are ways for that to be done, and local communities need that. If not, for example, this week, the city has called on each of its department heads to look at how they cut 18%. There's no way you can do that in the city of Dayton without seeing police and fire and public works hit the streets. So that's a big challenge for us.
Has there been any talk with the state about being able to help some of the or not all of the homeless people? We can't leave them out. It's a known fact that they're not going to the doctor every day.
Right.
And will the city of Dayton, again, ask the state for some kind of grant money where the city could, in fact, go out and look for these people?
Well, I think there's opportunity in the CARES money that was put down from the federal government to the state, that there'll be opportunities for that. And I know the commissioner and I have had those conversations, so we're hopeful about that.
Last but not least, if I may, from your office to our city, do you have any concerns for your staff who are maybe not so willing to come back to work out of fear of this ain't over?
Well, I mean, we're gonna, our essential employees are through the stay-at-home order through the April 30th date. We're assessing that right now. For us, I think all business, like the Dr. Doan said, will do things differently. I think we will have to assess in places in the city hall, that maybe they're sitting too close together cube-wise. If you remember, and there's this balance between collaboration and places that collaborate and how they do really well, but we need to make sure they have space now. And so all governments, all private sector are going to be dealing with those issues.
And since Montgomery County, Dayton is the innovators of the world, past and present, have you given the governor any ideas to help move this along?
Of course, yeah. We talked to, I never thought in my life I'd talk to Governor DeWine as much as I do. I talk to him every day, and he has ideas for me, and I have ideas for him, and it's been a great relationship.
Would you be willing to share a couple of those, or maybe one?
I don't know. I mean, I think the governor's been really great, and just like he's been very hungry and wanting to hear what's on the ground. And so, particularly when the stay-at-home order happened, he wanted feedback of, were people following it? Did we have to enforce heavy? What did that look like? And we gave, I gave that feedback, mostly because Commissioner Cooper and others would share that information, or we'd hear that from our police and fire as well. So he's been very curious about all of that.
And last but not least, Mayor, are there any companies on the radar, such as Henny Penny, who stepped up tremendously, who aren't on the radar, that should be on the radar for helping out the community?
Well, I'm going to have that list the next time we meet. So I will get that, and we will definitely share that, because there are lots of folks, and we want to, I think maybe Sarah will help too. We'll put a list together just on the people that have helped so far, so we can give some credit to those folks.
And I promise you, I'm not running for any office. So
Chris,
I
yeah,
have
what
more.
election are you for? Yeah.
But my last question to you, Mayor, out of all the things that have been happening in your tenure as mayor of the city of Dayton,
Yeah.
how prepared are you to step up for not only yourself, but for the community, to say if this does not go well, you will immediately notify the governor?
Oh, I'll definitely do that. I think everyone knows in government, I think, for better or worse, my reputation precedes me is that, I will always tell you how I'm thinking. So my perception of reality is always pretty much up front. Thank you. You guys good?
Well, let's just see if there's anyone on the phone. Does anybody on the phone have a question?
I just wanted to reaffirm that there's a new schedule for these press conferences.
Yes.
When-
Moving forward, they'll be held Tuesday, Wednesday, or Thursday. Tuesday, Wednesday, and Thursday, barring anything that needs to be notified immediately.
Surprises.
Right. Okay. Oh, more questions?
Sorry, when is that effective?
It starts today, so there won't be one, the next one is next Tuesday.